today we will discuss about the burns. In burns, first we will discuss about definition, then types, then etiology, then signs and symptoms, then complications, then nursing management, surgical management and medical management. So first we will discuss about the definition of burns. So any injury to the tissues of the body which may lead to the cell destruction of the layers of the skin caused by the various sources including heat, so radiation, chemical and electricity. Mainly burns will affect to the tissues. So tissue damage or tissues death which may lead to the cell destruction in the layer of the skin. It may caused by heat, any heat substance or any radiation substance means, so ultraviolet rays from the sun or any chemical substance means, so any chemicals, acids or any detergents, so it may affect to the our skin. Then electricity means electrical current. So now we will discuss about the types of burns. In classification based on the depth of the burns, in that there are three types: first degree burns, second degree burns and third degree burns. Now we will discuss about the one by one. So now we will discuss about the first degree burns. It is the mildest of the three and it limited to the top layer of the skin. These burns produce the swelling, pain, redness and healing time is about 3 to 6 days. So it is the mildest to compare. So third degree and second degree, it is the mildest one and it will affect only to the our upper layer of the skin. So upper layer means epidermis. It will affect the epidermis to the skin and it produces the pain, redness and swelling in the skin and it may heals the 3 to 6 days. So now we will discuss about the second degree burns. These are the more serious and involves the skin layers beneath the top layer. So compared to first degree burns, this is the most serious one and it will affect the dermis and subcutaneous tissue. Then these burns produce the blisters, severe pain and redness in the skin. So the healing time is about 3 to 4 weeks. In 3 to 4 weeks it may cure. We will discuss about the third degree burns. These are the most serious type of burns. So compared to first degree and second degree, this is the most serious type of burns. It involves the whole layers of the skin. So it involves epidermis, dermis and subcutaneous tissues. So it involves all the layers of the skin and it involves the nervous also. So then it appears the dry and waxy white and brown color in the skin appears. So this may the little or no pain or the area. So it may feel little pain or no pain because of so nervous damage or in patients feels numbness in that area. Now we will discuss about the etiology. So etiology means causes. So main art objects. So in art objects means any art water or any hot objects like oil, then flames, it may cause the burns. Then electricity means in electric current. In electric currents means so we will get our skin burn. Then chemicals means chemical agents are acids, any toxic agents. So it may cause the skin burns. And radiations means in radiations ultraviolet rays from the sun, it may cause the burns. Then gases. So gases also affects the burns to our skin and overexposure to the sun. So sun may cause the radiation. So ultraviolet radiations, infrared rays. So it may cause the burns to our skin. So now we will discuss about the clinical features of burns. First one, so if any patient having burns means it may lose the first skin barriers. So the patient will lose the skin barriers. Then hemolysis. So any person is having burns means it may cause the hemolysis. So hemolysis means breakdown of the red blood cells. Then hypoxemia. Hypoxia means low oxygen in the blood. So oxygen deficiency. Then decrease the circulation of blood volume. So blood volume also decreased. Then increase the blood viscosity. So viscosity means blood becomes too much thickness and does not flow normally. Then decrease the blood pressure. So blood pressure will decrease. So now we will discuss about the complication of burns. So hypovolemia means so decreased in the blood volume in our body. then infection will occur. So then hypothermia means, so in our body temperature will drops out, and estrus means our body tissues will become dead in the condition of burning or any wound. So in scaring means in our skin it may appear as the scarings in the skin. So now we will discuss about the diagnostic test of burns. So first we will collect the history from the patient, then we will do the physical examination, means from head to toe we have to examine the patients, then blood examination we will conduct, then x-ray, then electrolytes level. So electrolytes are balanced or imbalanced we have to check. Then rule of 9 means it is estimated to the percentage of total body surface area that is burned in the adult patient. So how much percentage of total body burned, so that we will calculate in the patients. So now we will discuss about the management of the burns. First, medical management. In medical management, topical antibiotics and anesthetic will administer for the burn patient. So what is the topical antibiotics means? It reduces the risk of infection in smaller burns and may facilitate the development of multi-resistance bacteria. So it may decreases the infection in the topical antibiotics may reduces the risk of the other infections, and it may reduces the multiplication of bacterial growth, and it now we will discuss about the medical management of burns. In medical management, topical antibiotics and anesthetic will administer. So now we will discuss about the topical anesthetics. So it reduces the risk of infection in smaller burns and may facilitates the development of multi-resistant bacteria. So topical antibiotics will reduces the risk of further infection, and it may reduces the multiplication growth of the bacterial infection. Then anesthetics, so it provides safe and effective analgesics, so without loss of consciousness for the treatment of the burned patient. So it is the safe and effective treatment for the burned patients. Example, nitrous oxide. So now we will discuss about the surgical management. In surgical management, wound closure and hysterotomy will conduct. So wound closure means it is the permanent wound covering which is made and grafting is performed. So it is the permanent covering of the wound. It is made by the grafting of skin. Then hysterotomy means it is a surgical procedure in which an incision is made in the lengthwise to the hyster of the burned area to facilitate the circulation. So hysterotomy means it is a surgical procedure in which a small incision. So small incision means small cut will do in the burnt area, and it do facilitate the circulation in the burnt skin. So now we will discuss about the nursing management. So instruct them to keep electrical appliances away from the water. So we have to instruct the patient's family or patients, so keep away from the electrical light, electrical wires or any electrical things, so away from the water. Then instruct them to unplug the iron box and devices, similar devices when not in use. So we have to advise the patients for unplug the iron boxes or any other similar devices, so not in use. Then instruct them to keep hot liquids out of reach of the children. So we have to instruct the patient's family, so we have to keep away from the hot liquids or any hot materials away from the children. Then as they do not cook while wearing the loose fitted clothes. So we have to instruct the patients to not wear the loose fitted clothes while cooking. Then ask them to keep the chemicals, lighters and matches out of the reach of children. So we have to keep away from the matches, lighters and so chemicals from the children.